Good evening, everyone. It's a pleasure and an honor, as usual, to spend some time with you. I'm quite sad that we're not doing it in person. One of the highlights of our year is the Faces of Resilience event for us to get together and update each other on our progress for the past year and where we're headed in this coming year. So even though we can't be together, I felt that it was an important time for us as a team to get together to share with you all the things that we're really proud about and all the things that we're really grateful for, and yet let you know about the important work that still lies ahead for us. This is a Faces of Resilience event, and there's been no time ever before in our city, our state, and our country's history where we've been asked to be more resilient than ever. We as a faculty and as clinicians have really been at the front line sharing facts, science, and information to the public on the news media, both in print and on video, involved in podcasts and writing blogs to let the community know about how we could be a resource for them in these times of immense stress and adversity. Last year, when we first met, I made several pledges that tonight I wanted to update you on so that you know that not only am I doing work, I'm also moving the needle forward for us as a team and for us as a community. First, I pledged that we would work to find the right treatments and give it to patients at the right place and at the right time. Essentially, meet patients where they are in order to get them the best care as early as possible. The first thing that I think I wanted to let you know about was that Harding Hospital almost doubled its inpatient bed capacity. This gives important access to many of our patients in the community that are struggling in times of crisis. We are one of the largest psychiatric hospitals in all of Ohio, and certainly the largest of all academic medical centers in the Big Ten. Second, we stood up a brand new bridge clinic, as we call it, otherwise known on a more fancy term called behavioral health immediate care. And it's just that. We stood up a clinic to provide urgent care for patients in acute crises so that they don't have to visit the emergency room, but instead walk in and get care right away. The third thing that we did because of COVID-19 is pivot from very little of telemedicine to 100% telemedicine. So now we're providing treatment, both medication treatment as well as psychotherapy in the comfort and safety of our patients' own homes. This is meeting patients exactly where they are to the core. Fourth, we formed a new division in the department called the Division of Health and Integration. The aim of this division is to break down the walls that often separate patients from our clinics and our hospital, and instead go to patients wherever they are in their own primary care clinics, in a hospital bed throughout the medical center. We'll be there for our patients, and that's the ultimate goal of this division that integrates mental health and behavioral health and physical health in the patient who might be at anywhere across our medical center. And fifth, but certainly not least, we are leading the way and partnering with the county to build a new crisis center that's going to be located in the community. More to come on that, but those are the 5 different ways that I believe the department and Harding Hospital have stepped forward to give patients the right treatment at the right place at the right time. I also pledged that we would build programs of distinction so that we are known in the community, in the state, in the Midwest, and in the nation for providing care at high quality and first-rate delivery that is comprehensive. We've done that in a number of different ways, and we continue to do that and build on that every day. We lead the way in caring for healthcare providers. As part of the STAR program, we've been doing it for more than a decade. This year, these last few months, more than ever, we stood up new programming so that our healthcare providers, our new modern day heroes, has 24/7 days a week access to our clinicians. We also have daily call lines open for patients to call in and join support groups. And we set up a fast track so that patients or healthcare professionals who need treatment can get care immediately with one of our clinicians. I think we also lead the way in caring for patients with treatment-resistant depression, early psychosis, and chronic psychosis. And we also lead the way in trauma care, addiction care, and opioid crisis care. The community knows us for those key areas. There are two areas that we want to stand up this year that are really important for the community as well. The first is in developing specialized programming for young adults. As adolescents enter adulthood in their late teens into their early 20s, they enter a very vulnerable period as they separate from home to enter college or enter the workplace, and they're establishing new relationships outside of their family. Even though these are exciting times, it could also be quite stressful. And I want to build a program that is focused on young adults so that they transition smoothly and successfully during the most important time of their lives. Young adults are the fastest growing segment of Columbus and Central Ohio. So we need to be there for them and develop programming that is targeted and tailored for them. The other important area is in suicide prevention. As I've said in the past, and remind all of us, 120 Americans die each and every day from suicide. And those rates are higher and higher and climbing in Columbus and in Central Ohio more than anywhere else throughout the region and even in the country. So we are an important area to tackle this problem. And I am very delighted to share with you that the department and the university has recruited Dr. Craig Bryan, who is an internationally renowned scientist on suicide. Not only does Dr. Bryan work to better understand suicide, his work also prevents suicide. So it's a combination of science and applied treatments that you will hear more and more about as you meet Dr. Bryan, who started with us this month. And more to come about how we as a department and a hospital are going to be tackling suicide prevention more directly than we've ever done before. The third thing I pledged was that we always were going to be looking at our past, but focused on our future and thinking about areas of gaps, areas of challenges that we have not been able to successfully meet. And for us, I believe that we need to be more in the community. We need to engage the community more. And that's why we developed an office for community engagement. And more importantly, the question is, what can we do for the community? And for me, the answer is we can build resilient communities. We need to build resilient tools that can help harness patients, people's, families, individuals, neighborhoods, their own power, their own networks, so that they can have a larger reservoir of resilience, that they can have more tools in their arsenal for resilience, so that they can bounce back from adversity and face adversity head on. Because it's about postvention as well as prevention in healthcare, in my mind. And for us, we spend much more of our energy historically focused on the negative things, and we don't know as much about the positive things. And to me, resilience is a positive way to think about how do we bounce back and how do we face adversity, stress, and trauma head on. More importantly, these resilience tools are best deployed not in a clinic and not in a hospital per se, but right in the individual's homes, in their neighborhoods, in schools, in their workplaces. This is where resilience needs to be built, because resilience building is a daily activity and not once in a few weeks or once in a few months activity when you see your provider. It's things that we need to be responding to the community more. And that's why I believe it is important for us to focus our first center of excellence on resilience, to pay attention to trauma, stress, and adversity, but then to pivot towards the other side, which is building resilience against those three things. So those are my major updates for tonight. And you'll hear more and more from Amanda, Ken, and Ariana, as well as Holly, on specific things that they're doing in order to further the mission of the department, as well as Harding Hospital, and ultimately for our new Center of Excellence. Thanks very much, and I hope to see you soon.
Good evening. I'm Amanda Lucas, the Executive Director of Harding Hospital and Ohio State's Neurological Institute. For Harding Hospital, maintaining access to emergency and inpatient psychiatric care for those across our community has always been a priority, and we were committed to maintaining access during COVID-19. As a psychiatric emergency department, serving over 8,300 patients in crisis annually, and as a hospital who serves over 3,400 annually, we were challenged by COVID-19 as to how we provide the highest quality of care in the safest environment for our patients, faculty, and staff. Early on, we decided to meet daily as a care team so we could respond to new information from the CDC, Governor Mike DeWine, and the medical center leadership to inform how we made changes in policies, procedures, and daily operations to provide care and keep everyone safe. Over the weeks, we changed our visitation policy, operationalized our rooms to be all private, taught our staff to don and doff on the necessary protective equipment, and began to use telemedicine to provide care that was previously provided face-to-face. The changes we made during this time have been never-ending, but we have managed to now have a process to swab all patients at admission, reestablish semi-private rooms, and are happy to report we did not have any COVID outbreaks on our units or across our staff during the pandemic. Truly, this is a result of a team who was able to be nimble in the face of a challenge and respond in a way that kept quality and safety as our top priority. We also made a bold move and stood up a new program to address access during COVID-19. On April 8th, we opened up our Behavioral Health Immediate Care program to not only serve those being discharged from our care, but also to provide a venue to better serve healthcare professionals during COVID-19. Our team was amazingly responsive to this plan, and many faculty and staff volunteered time to catalyze our response as the program was not scheduled to open until June. During the peak of the COVID-19 crisis, we served over 30 patients in this new care model, and we are now restructuring the model to operate as originally planned. We are not finished responding to COVID-19, and we will continue to change our operations to provide care in the safest manner. The stress of the ongoing changes has been trying for our leadership team, faculty, staff, and most of all, our patients. At times like this, we are beyond grateful for your ongoing support to keep us focused on the positive gains and help us continue to build resilience. Thank you.
Since its inception, the Stress, Trauma, and Resilience, or STAR program, has sought to mitigate the impact of trauma within the community as well as within the healthcare professionals in the OSU Medical Center. Our initial work in the area of psychological trauma began within OSU Harding going on 11 years ago now. At that time, we were beginning to understand and actively work to quantify the impact of trauma on the patients that we were serving. We also grew to have a greater understanding of the need to provide a trauma-informed care approach or model to lessen the ongoing impacts of trauma. Early on in the STAR program, we began to understand the extent and severity of the impacts experienced by patients, the traumatic life experiences that follow them. We began to understand this at an individual level as well as an organizational level. We began to see that care providers were impacted by the trauma that their patients had experienced. We began to understand that individuals who work in law enforcement, healthcare, EMT, and fire are also asked to do things that nobody should ever have to do. And as a result, they experience vicarious trauma in as much as they see things that no one should ever have to see. Today, the STAR mission continues to provide assistance to those who have experienced trauma, addressing the lifelong impacts of that trauma experience. The STAR program has, with funding from the Ohio Attorney General's office, created a trauma recovery center for victims of crime, serving individuals who have been a victim of crime within the past 3 years. STAR continues to provide support for healthcare workers in the time of the COVID-19 crisis. The program has developed an innovative peer support model. It is called the Brief Emotional Support Team. These support teams are comprised of over 800 peer supporters from all disciplines across the medical center, providing support and understanding the unique needs of healthcare providers. This work has gained recognition from the Academy of Medicine as a best practice model. In the midst of all of this work, the STAR program has provided over 50 short center rounds, which are social and emotional case studies that function to begin conversations between staff related to the unique challenges faced within healthcare. Finally, the STAR program continues to provide research and innovation in developing technology in the form of a phone app. This telephone app is to be launched the end of July or early August. It will provide state-of-the-art support to first responders in addressing vicarious trauma and traumatic stress. The phone application has delivered statistically significant outcomes in initial testing in the reduction of the impact of stress experienced by first responders. It is the ongoing mission of the STAR program to continue to find new and innovative ways to address psychological trauma.
Our Trauma Recovery Center has been working diligently to respond creatively, effectively, and holistically to the dire needs expressed in traditionally underserved communities. As our world is challenged by the impact of COVID-19, and as our nation actively struggles to confront and address the inequities created and maintained by systemic oppression that has led to tragic outcomes for so many, the STAR program continues to create pathways to care and support. We're in it for the long haul, working to build a meaningful foundation of trust, compassionate care, tangible resources, and linkage that eliminates traditional barriers to accessing treatment. The work begins with listening, demonstrating genuine care and compassion, engaging in conversations, offering information and options, and destigmatizing the treatment process. Even during this time of crisis, when it was necessary to shift operations on a dime to function in a telehealth format, our team remained thoughtful about maintaining safe avenues for in-person care as needed when a patient required material assistance or did not have access to a safe environment from which to engage in a telehealth session. Our therapists continue to utilize evidence-based treatment modalities to assist patients to cope, heal, and build resilience. Our outreach coordinators and vehicle operator mobilized quickly to focus on delivering donated meals to human trafficking survivors who would not otherwise be able to access this assistance. I feel proud to continue to show up when and where it counts to create a stronger support network for those who've been disproportionately impacted by stress, trauma, and adversity. We still have a lot of work ahead of us. Meaningful change takes time and energy and effort. Real healing also takes time and energy and effort. Thank you for continuing to be a part of this change and healing. It's all hands on deck. We need you now more than ever.
Education and outreach are core goals that are fundamental to the university's mission, vision, and values. As a public university, we are committed to advancing a culture of engagement and collaboration with communities in Ohio, the nation, and the world. In short, the very reason we exist is to serve you and the wider community. With the advent of COVID-19 and the civil unrest as a result of recent protests for racial equality, it is clear that these are challenging times. But we know that traumatic events bring opportunities for change, and the leadership at OSU Harding Hospital and at the Department of Psychiatry and Behavioral Health see many reasons to be hopeful. The importance of mental health and resilience are now top of mind for everyone, and great progress has been made in reducing the stigma around accessing mental health services. Planning is underway for a new STAR Center of Excellence that will serve as the community-facing arm of our department. It will be a place of collaboration and innovation, where our research, clinical services, and educational activities will focus on bringing science to the study of resilience. All of the work at the center will be community-focused and community-driven. We are so grateful for your generous support, but in many ways, our real work is just beginning. We hope you will continue to actively partner with us as we work together to build more resilient individuals, families, and communities in Ohio and around the world.
Good evening. My name is Irene Adams.
And my name is Ted Adams, and together we are the 2020 co-chairs of the Faces of Resilience event, which supports the STAR program at The Ohio State University Wexner Medical Center.
Your commitment to this work has been critical, and the difference in the lives of so many patients and their families. Your investment in our work means better treatment options.
We are both very passionate about this work because mental and behavioral health are core to who we are.
The compassionate care that Ohio State provides through various programs is a comprehensive support of nurses, doctors, caregivers, and patients. We are so proud of the work that they are doing, and especially now, the kind of transitions that they've made to continue to provide care for those in the community. We've seen growth over the past 11 years that the STAR program has been in existence, and that's primarily thanks to you. So we thank you from the bottom of our hearts, and we celebrate you and your resilience during these difficult times.
Everyone's support, whether financial or in time or in other ways, is valued. So we're here to share with you that with your generosity, we've raised over $400,000 to support the STAR program. So congratulations, because you are a difference maker.
Ted and I would just like to leave you with this final thought. There are so many people that you will come in contact with who are trying to heal from things that they will not talk about. But I think right now it's vitally important that we understand what is happening. And in these times, we have to be able to listen. Ohio State is here to listen. We're ready for you. Thank you.
Hi again, everyone. I wanted to spend some time and close the event with everyone again. Really appreciate everyone on the team for sharing with you what we've been up to what we're proud of, and where we're headed. This is a stressful time. We know when we talk to each other, our families, our friends, our neighbors, that we're hurting. Our neighborhoods are hurting. Our country is hurting. We were hurting and stressed even before COVID-19 hit because of the rising rates of suicide as well as deaths from drug overdoses, and the increasing prevalence of mental health challenges in our young people as well as our adults. So we were hurting before. Sadly, we're hurting more and more, from COVID-19 to physical and social distancing, to financial stress, to divisions within our country as we face the problems of systemic racism and health inequalities, as well as financial inequalities that exist in our country. These are major events. These are major experiences that have mounted upon one another. And because we are more distant physically than from each other than ever before, we can't rely on the buffers, the stress relievers that we've used in the past in order to overcome some of these stressors. So I am worried about where we're headed. What I want you to know is that there's never been a more important time to stand together, to lock arms, to join each other in this fight. I am and our teams have been immensely grateful for all your support over the years. We do have lots and lots of work ahead of us, and I hope that you can trust us in building upon the work that we've done in the past and doing a better job than we have done, and doing a better job than we need to do. Know this, and you've heard this so far. We are in the deep end of the pool. We are taking on the biggest challenges that face our community in terms of mental health and mental illness. We are in it for the long haul. This is not going to change anytime soon. And we believe in having gains early, but also having a strategy where gains are built over time so that the mental health and well-being of us as individuals, as families, and as neighborhoods are sustained over time, so that 10 years from now, we look back to 2020 as being a pivotal year that we began to steer the ship towards mental health. Lastly, our work is not possible without your involvement and your engagement. We will look to you and engage with you to get ideas, to answer questions, but also to seek your talents and your input. What does the community need and want from us, and how can we be of better service to our community? You'll hear a lot of that in the next few months as we begin to build a center of excellence that faces the community and addresses the biggest gaps in mental health care right in our community and beyond our department, our hospital, and our clinics. Thanks again for everything that you do with us, and thanks again for spending some time with us this evening. See you soon.